Trainee doctors are to get financial incentives to become family GPs in parts of England where there are shortages. The Health Secretary, Jeremy Hunt, wants 5,000 more doctors to go into general practice. But in return, he wants GPs to provide a 7-day-a-week service. As our health editor, Hugh reports.
Rural Wiltshire, it all looks serene and nobody seems to be making too much noise about the state of general practice. At the surgery in the heart of the village, patients can get an appointment on the day if they want one.
Yeah, you sound a bit croaky.
A bit croaky, yes.
So here, doctors feel strongly there's no need to open at weekends, whatever the government may call for. If they had to, they argue it would undermine the service during the working week.
We see patients when they want to be seen, and that is during the working week, on the day that they want to be seen by the doctor they want to see. And that means they don't need to call out of hours except in a genuine emergency.
But in health terms, it's a world away from the rural villages when you get to the big towns and cities, where 7-day-a-week opening is already happening in some areas.
Hi, good afternoon. Barlby Surgery.
This West London practice is open for up to 13 hours on weekdays and 8 hours a day at weekends. This is what the government wants to encourage.
We've had over 100 patients coming in over the weekend. We offer a nurse and a doctor and they're fully booked. So the demand's there as far as we're concerned, and it's growing. So we're looking forward to actually recruiting more doctors to work for us.
Patients like it, and it helps take the pressure off hospitals.
It was only once that I made that appointment and I got seen, and it was good that I didn't have to wait in casualty for 4 hours, to be seen.
The Health Secretary wants practices to move towards providing appointments every day of the week for those patients who want them. And he says his side of the bargain will be ensuring there are enough doctors to offer that service, as well as dealing with existing recruitment problems. And some areas find it harder to recruit GPs than others. In Wirral, for example, there are about 7 GPs per 10,000 patients. In nearby Warrington, the number is fewer than 5. In London, Islington has about 7 GPs for every 10,000 patients, whereas Bexley has just 4. Jeremy Hunt's answer is financial incentives to encourage trainee doctors to choose general practice in areas which are struggling to fill vacancies.
We need to make sure that we channel the new GPs that we recruit into the areas that need them the most. And that will need some incentives.
Hello, collecting please, Joe.
But the detail of how it'll be implemented isn't yet clear. Many GPs say with rising numbers of patients and a higher workload, action rather than words is needed right now. Hugh, BBC News.